I'm going to come to you after. I just want to ask Chef AJ a quick question. How do you cook food and make it taste good without oils? It's like sauteing onions, garlic, all that stuff that people think they need oils for.
You don't need oil. You really don't need anything. But if you really want to use a liquid, you can use water. You can use vegetable broth. You don't need it. I don't know where this came from in culinary history. You really don't need it. You need a good piece of cookware, and you don't need oil. You save so many calories, so much time, so much money, time on cleanup when you don't use oil. And it actually tastes better, as I mentioned in my previous talk, because when you use a lot of oil, you got to use a lot of salt to taste it because it coats your tongue. It's actually very easy. It's just this is how people learn in culinary schools or from whoever teaches them to cook. You don't need oil. If you need a liquid, you can use water. It's free.
Thank you. And Dr. Nagra, what do you think about the foundation of a plant-based diet?
Yeah, I mean, I think the foundations, again, I did talk about it in my my presentation earlier, but a foundation of fruits, veggies, whole grains, legumes, nuts and seeds. Those are the general foundations. Now, I'm not, I think from a calorie standpoint, limiting oil, absolutely. From a heart health standpoint, I haven't seen data suggesting that it is necessarily an issue. And in fact, especially polyunsaturated fat-rich oils tend to lower risk of cardiovascular disease based on Nurses Health Study, Health Professionals Follow-Up Study, the LA Veterans Administration Hospital Study, and by lowering lipids like, again, LDL cholesterol and whatnot, which I know there's a little bit of discussion there earlier, but again, no matter how we lower LDL cholesterol, whether it's through medications like statins, PCSK9 inhibitors, dietary intervention, bile acid sequestrants, we lower the risk regardless of the mechanism. So I think that's pretty compelling data that those are markers to look at as well, and that's where oils can be quite beneficial for people. But generally speaking, especially if weight loss is the goal, then yeah, absolutely, I do think limiting oil can go a long way for a lot of people.
Okay, thank you for that. Now, I just came from a panel with Dr. Gabriel Cousin and Brian Clement, and they were very big on fructose being a problem, and fruits that contain fructose being a problem in the diet. And then they were into beneficial fats, not animal fats, but but nuts and seeds, those types of things. So Dr. Nagra, what are your thoughts on the hazards of fruit, for example?
So I haven't seen any data suggesting harm. I mean, we have studies up to like over a dozen servings in a day. And the one side effect was very big bowel movements. Like that was pretty much it, which most people could probably use that too. So I am not concerned about people consuming fruit. I think if somebody has diabetes and they're working on treating it currently, and they were to have large amounts of fruit, then yeah, their blood sugar could be elevated for extended periods. So it's not something to go all in 100% on right out the gate if that is you. But for healthy individuals, I just haven't seen any evidence of harm. And in fact, fruit consumption is consistently associated with great health outcomes.
Okay, thank you. And Dr. McDougall, what are your thoughts on that hypothesis?
Well, the diet I teach is a starch-based diet with fruits and vegetables. So the thing about fruit is that it's really tasty. And there's a reason it's tasty. It's part of the human diet. We are naturally attracted to things that are good to us, good for us. The problem is it's too tasty, especially when people first start the program that we teach. And they'll sit down, they'll eat, because it's familiar, because it's sweet, they'll eat, 20 nectarines at a sitting. And you can get carried away with that much simple sugar. Simple sugars are not as satisfying. You don't stay satisfied with your hunger drive as long with simple sugars as you do with starches. So I think it's a nice side dish. I don't think you ever have to eat fruit. Likewise, I think if you eat more fruit than I just told you about, I think most people do. The other thing that you might think about, because you just talked about heart disease a little bit, is that I found that simple sugars, and including fruit and fruit juices, have a tendency to raise triglycerides, the fats in the blood. But that could be an issue. And then again, it's not a real strong risk factor. Triglycerides aren't. And then the most important diet that served for me when I was learning about diet therapy came from a Dr. Walter Kepner at Duke University. Dr. Kepner taught the rice diet. He was there for 7 decades. He's published in our major medical journals. He really is the pinnacle of diet therapy. And Dr. Kepner would, cure obesity, retinopathy in diabetics, severe morbid hypertension, not the wimpy stuff that people listening to this program have. That was his results, published uncontested. He did it on a diet of rice, fruit juice, and table sugar. And I don't know. I mean, I use the Kepner diet when I'm taking care of patients that are really, really sick. I call it the diet for the nearly dead.